Hello, everyone, and welcome to a special edition of Litter Media Live. I'm your host, Mike Smith, along with Barbara Mahaffey of the Scioto Paint Valley Mental Health Center. We have a number of things that we need to get caught up with Barbara on what's happening at the Mental Health Center, and we'll do all of that in just a moment. Our interview today brought to you by your local McDonald's restaurants.
Whenever I first applied for the Archways opportunity, do I have to pay this back? Do I have to do that? Like, is it a loan? And it's not. It's a scholarship. A goal of mine is to graduate college debt-free. If you're a crew member, you get $2,500 a year, and if you're a manager, you get $3,000. And especially if you're going locally to college, like to the branch or something like that, it's really helpful.
We're back with Dr. Barbara Mahaffey of the Scioto Paint Valley Mental Health Center. Barbara, good to see you again.
Yes, it's been a while.
Yeah, we were just trying to get caught up. When I first came on board, of course, we talked to Barbara when I was on the radio many years ago, but when I first came on board at Litter Media 3 years ago, that was my first solo in the field video project, was coming out and meeting you and some of your staff out at your office. So good to catch up with you. A number of things we wanted to talk about, and you said a lot of changes taking place.
Oh, my goodness gracious. Well, 5 years goes by really quickly, and so does 3 years.
Yeah.
I mean, every month there's something new. The Scioto Paint Valley Mental Health Center, when I got there over 5 years ago, was in need of a lot of changes and a lot of upgrading. So recently we've been upgrading, especially the substance use facilities, residential facilities, but also not only that, but in the last year, we've added another step-down supportive living house in the Ross County area, and that makes, so since I've been there, that makes a total of 3 new step-down substance use facilities that are housing that really help with people that are transitioning and getting to be independent and getting to be in recovery. Recovery is the big impetus now. Since the mid-1980s, we've had a mental health step-down and another apartment that we have operated. And then we have also grown as far as other projects. For example, we're anticipating the opening of an office down at MacArthur Gardens. So people don't realize that it was a joint venture where the Scioto Paint Valley Mental Health Center actually had possession and owned the property underneath the old MacArthur School. So the Scioto Paint Valley Mental Health Center donated that, the Board of Trustees, and I was part of that, signing off on that, to Integrated Services, who then is building housing and trying to finish the initial project. They have a secondary project they hope to complete later. We have no date or information on that yet. But so hopefully that open house will happen soon. But we're busy. We've staffed that location, a counseling office, because Scioto Paint Valley Mental Health Center will be offering the counseling there, and then connections to other programs such as the medication-assisted treatment program, the counseling program, and also the psychiatric services program. So, and then, for example, later on this week, I'm hoping to add even more psychiatric services to the Scioto Paint Valley Mental Health Center, as well as the counseling. For example, 3 weeks ago, I took on 10 new students from Ohio University to open up so that people, when they call in, they can get the same day or same week appointment. So I've been working on improvements for over 5 years. As you know, you've heard about the Rulon. That was the first project I took on when I started my position there. And soon, it's the end of February, and we'll be celebrating the 5-year anniversary for the opening of the Rulon Center. And the Rulon Center is a SUD, residential 90-day treatment program that we have 36 beds there for men. And then another thing of interest lately is the recently I had to transfer staff from a location named Lynn Golf Clinic in Greenfield to 3 different places wherever we have job openings. You see, the mental health center and the community mental health center, we're a private nonprofit organization, and so we're limited with what we can do, and but we are expected to do everything, right? We're funded primarily through Medicaid, Medicare. We have 131 at least as of last December insurances that cover services through us. But we have a sliding fee scale, so that people can come. And then, so we've got all these different locations. So now we're up to 7 outpatient. We've got 18 buildings, lots going on. We were hard hit by COVID this year. More COVID in staff, more COVID in residents than from the beginnings of COVID in the United States. So we've struggled with being able to staff. Plus, there's been a workforce shortage that I've been talking about to others since actually started with the beginning of COVID that we're hardest hit. For example, in 2021, I had 13 people leave community mental health work and only could replace 5 of them. Another thing that we've been working on is expanding with grants and trying to help special populations. For example, the leadership, they wrote a grant for SAMHSA. We've got that, so we're in the jails in the counties. We serve Pike, Ross, Pickaway, Fayette, and Highland counties. And so we're in those jails trying to help people transition into recovery for the SAMHSA grant, because most of the grants have been only for substance use disorder treatments. So our plan was to offer what is called still a wraparound treatment approach, where we try to meet people where they are, whether or not they're people that have troubles with homelessness or people who have troubles with substance use and mental health. And a lot of people, for example, don't realize that the Scioto Paint Valley Mental Health Center, that has been in operation since 1965, and then in 1977, that's when the Crisis Center opened up in the old hospital building on Chestnut Street, and we've just been continuously operating all this time. But so there's been challenges with something in 2016 called the Behavioral Healthcare Redesign, where we went from starting about 1993, there was financial troubles with different governments deciding who funds what. And then so slowly it's gone to a mostly, not all, mostly reimbursement model, where if you offer services, then you get paid. Well, that makes it a whole new ball game instead of having something that's supported nonstop, because you have to have dedicated staff for dedicated grants and have to, figure out a lot of different details and a lot of different complications. So a lot of people that have been around the areas, the 5 counties for a while, just believe that we should have everything funded. And so I've spent a lot of time trying to scramble. And for example, Fayette County Commissioners, they were wonderful. They gave us an ARPA grant to work in the schools in Fayette County. For example, in one of our buildings in Pike County, or the only building we own in Pike County, the furnace all of a sudden started kicking out carbon monoxide. And thank you to the Pike County Commissioners who reacted quickly to help us replace that furnace that was threatening to poison clients and staff. So that's just some of our struggles. But for example, in the residential facilities, if we don't have residents who come in with a billing source, until January 1, we don't get paid, for example, for not having clients there. So imagine our staffing issues when we're trying to keep the quality things going. So, but luckily, let me say this about the leadership and the people that work there. We grew. When I started working at the mental health center again, because I had worked there before, there was 97 employees. Mm-hmm. Now there's somewhere between 170 and 180. And then it's just been such a pleasure because I really enjoy supervising people that are trying to finish college and get to be their counselor trainees, and we have some social work trainees. And I also this year was able to get 3 doctoral students as trainees. So that's a really exciting proposition.
So of all of the clinics that you existingly had, only Greenfield is you've had to suspend for the time being.
Right. Suspend the treatment, because the other thing is too, we want the quality people in there doing the work, mm-hmm. and staffing it. So I've got I think I've got the best staff, and I've got a couple of them, especially one person is focused. She's written most of the curriculum. We've reviewed it. It looks fantastic. And we're in the process of training so that we can have an upgraded, quality service that are we pride ourselves on staffing people that have the licenses and the experiences and the certifications and the knowledge on how to, and the ethics and the professional stances. So that's what's happening. I had a question last month, and someone said, well, can't you have a philanthropist step in and right? You see where I'm going?
Sure, step up, anybody.
Yeah, well, that's what I'm going. I don't know any.
Yeah, really.
I have not. No, we don't have any donations. Right. It would be absolutely awesome if somebody wanted to come in and give us money so that we can do extra things, but we're spending our own dimes to, and I'm saying dimes, literally, to train people. But I've just been fortunate. I had a bunch of students that came to work for the Scioto Paint Valley Mental Health Center when I started, and continuously, there's, and now, anyway, in 2022, we hardly had any applications. I mean, people, still didn't want to work but I heard this across, everywhere I went. It's like, well, we have a workforce shortage, and we have a workforce shortage, and and the other thing is too, I was lucky enough back, I think in 2021, to win a contest that provided $133 for each employee that agreed to sign a statement that they would stay a year, and that was our only bonus, really, as far as financial bonuses to help people. A lot of people don't realize what COVID did because to the mental health. Not only has the mental health needs grown, for example, last year we had just 17,216 calls to our regular crisis line. Also, another initiative we took on a year and a half ago was 988. So we now are the call center, and we answer the phones for 8 different counties, not only the 5 counties we have, but 3 additional counties. And then we do the backup in case some other counties don't get to their phones in time. We're working on so many projects. We have grants for women, grants for the first episode psychosis. We have the SAMHSA grant. We have an innovation grant through OMAS, Ohio Mental Health and Addiction Services, and then the Adam H., the local Adam H. Grants. So that's how we've been able to afford to expand somewhat, right? So we're hoping that the Board of Trustees has just last Tuesday, given me the authority to review and plan for the Lynn Golf location in Greenfield. And I've been talking to various people trying to find out who in Greenfield can help and operate. And then we'll be taking in people from all over, really.
Now, was that the only clinic in Highland? Is there one in Hillsborough too?
We have an outpatient clinic in Hillsborough.
Yeah.
We have outpatient counseling clinics open 8 to 5, and some of them are open different evenings until 7, 8, 9. Just to be able to serve people. And then the other thing is, luckily, because of Steve Montgomery, who's our main IT guy, we have 3, he was able to help get an FCC grant, so we were able to purchase laptops and other things, tablets and things to help expand our services into not only the jails, but to reach all the
Right.
places. And so, that's just been a lot of things have been going on. So
I know we've talked about this with the folks at Adam H. And you can weigh in on this too. A lot of the times when we see people out who are struggling with homelessness, it's not always just a drug problem. Sometimes it's a mental health problem or both.
right. And also, and what people don't realize is that there's most of the people, when you do the interviewing, and that's what we've been doing, is a lot of paperwork and data collecting. It starts out with trauma, and then it goes on to mental health, and then people are seeking to ease their pain, their emotional pain, and their physical pain, and so that it's a struggle.
Yeah. Is there anything in the other counties that resembles what Rulon does in Chillicothe, as far as the counties that you serve?
Oh yes. See, that's a problem, because independent companies or other agencies have residential treatment programs, and so and then for example, I heard that 26 different agencies, when it became nationally known that Portsmouth had a problem with substance use, people create companies, sometimes doctor run, but sometimes not, businessmen, and then they come in and they hire people, and then of course people with resources have more money to pay, and so that was another problem. The funding, that's a real big frustration,
Right.
because they come up with great programs, but then the funding goes elsewhere. And that's been a kick in my face, actually. I've been upset about that a lot. So, because here we are trying to do the best, and then we're limited. We have a pay scale that's pretty limiting at times, and then the salaries that people expect. I had somebody apply for a job, and they said, "Well, I'll take a salary between $70,000 and $80,000." And I'm going, we're a nonprofit, a private nonprofit organization that's, people are being paid more than I am. So, but I don't mind that. What I mind is that we don't have the resources. We don't have a safety net. And especially when we have COVID, and I have to limit and say, hey, we don't want to spread. And the employees have been great about that. So they really do the cleaning. We've done a lot of education on keeping people safe. Knock on wood, we haven't had anybody pass away. We've had some people pretty sick with COVID. For example, we have a pharmacy at the main campus, and we offer free, we reimburse. But our healthcare costs, our expense costs, our food costs for residentials, all increased, but our funding didn't.
Right. So if people want to get more information about the current services and in the various counties that Scioto Paint Valley Mental Health offers, is that all on your website?
We've got a website, and then we also have a Facebook page. So, like and, get on that Facebook page. And then, but I also ask people if they have questions, and this has been a struggle too lately, and especially the last couple of weeks, it started to really blossom, because what I did was, you see, executive directors have to, when they go to retire, they have to give a year's notice. So unfortunately, at the same time that all this was going on, the leaks start, and people are going, oh, Barbara's leaving. And I'm going, well, I have to give a year's notice. And I just, because at first I told everybody that I wanted to maybe, I could see myself dying in my chair at the office because I love that place. It's a legacy place for my family. There's been 5 of us, and in February we kind of, I know this, the rest of them don't. My mother's passed away. My mother was employee number 5 who passed away, but she retired, one of the first retirees from Scioto Paint Valley Mental Health Center. My younger sister, Cheryl Looney, worked there for 20 years. I had worked there before for 14 years, and now my children work there in various places with different supervisors. So, actually, before I came back, my son was already working at the Scioto Paint Valley Mental Health Center, and he's a licensed professional clinical counselor, and my daughter is a CDCA in terms of a chemical dependency counselor assistant, and she's even written a grant that got funded to help people in the jails and children in Greene County, actually, too. So, right. So, we're trying to help as many people as we can. I've hired so many quality counselors and social workers, and I've hired 5 nurse practitioners who work under the supervision. We have a wonderful medical director, and we have 2 other child psychiatrists, which is very rare. I'm still looking for a full-time adult psychiatrist, but I've been also open to contracting part-time to get the adult psychiatrist. But for 2 years, I don't have any full-time people that have applied, and of course they can get higher salaries with the other companies. So if you know an adult psychiatrist, let me know.
If you're qualified, give Barbara a call.
Yes, right. Yeah, and I don't mind it. I have an email. It's all lowercase, BMAHAFFEY @spvmhc.org, and then you can look it up, Scioto Paint Valley Mental Health Center, and then just reach out or email me a resume if you're interested in working, because I'm still adding people. And I was fortunate enough to be able to transfer some around in 3 different clinic buildings to retain the employees, and then also though mostly at the Rulon Center, so that it's the curriculum, the new quality curriculum is going to be trained at the Rulon, and so they're getting a lot of things. More employees to serve the men, but also the same training and the same curriculum that'll be expected otherwise, and so that'll be nice. So it's just a lot of things.
Yeah. Well, we're glad we had you in to get caught up. And so it's official that you are stepping away?
It takes a good question.
Yeah.
Great question. It takes a year. Okay. So in the next, I'm hoping the next 3 weeks, the Board of Trustees, they choose, right? They will place the ad. And so then they'll review the applications and they'll do the interviewing. And then I've told them, don't worry, I'm not going to run out the door, right? Yeah. I'm not into abandonment. Yeah. So anyway, so they've been working on it, and then they will continue to interview and make decisions. And then I train the next person. So that, because, it's not easy. Yeah. It's not easy being green, but it's not easy being Barbara either. I've got 94,000 emails to attest for it. And then I say to people, if you don't reach me the first time, email me again, because you might be buried. But and then or call the 988 or the crisis number, which is 740-773-4357, which is 773-HELP. That's the easy way that I was taught to remember it. And then my mother, when she worked there, and there was 3 of us working there at the same time, back in the late 70s to 1999 for my sister, I think, but I was there until 93. The main Martha Cottrell Clinic is that hosts, the outpatient clinic is the 775-1260, so 5 times 12 is 60, you see. So my mother had all these little things. And then my younger sister called it Spivmic, and I was going, what? What? Spivmic? And it's SPVMHC. So, she was great about rebranding and labeling things, but she's got the quicker wit than I do.
Yeah. Barbara, thanks for coming in and get us caught up.
Yes, well, I really appreciate it because there's been so many rumors and questions and things, and I thought, this is a perfect opportunity just to set the record straight and say, hey, we're okay, and don't get excited. I'm not stepping out and running away because that's just not my personality. So,
again, our special edition guest today, Barbara Mahaffey, Dr. Barbara Mahaffey of the Scioto Paint Valley Mental Health Center. She's been our guest on Litter Media Live, brought to you today by McDonald's.
Thank you, McDonald's.